Bismillahirrahmanirrahim. Assalamualaikum dan salam sejahtera. I'm Puan Rohani binti Yaakob, General Manager of Columbia Asia Tebrau. I would like to give advice to all the kidney patients in conjunction with the living with kidney disease. Yeah, in conjunction with the World Kidney Day on the 11th of March. Yeah, so for those kidney patients, you are not alone. Yeah, so I hope you can continue living as normal, be active, and then be happy. You know, there are so many patients are suffering the same condition as you. So it's very important for you to take a regular diet and to do regular exercise and then to live normally. However, you have to follow what is the advice by the consultant. Okay, that's all. Thank you very much, and then be happy always.
Hi, good afternoon. I'm Dr. T. Shin Kuan here, physician and nephrologist from Columbia Asia Tebrau. This month, March, was a month we usually celebrate our World Kidney Day. The reason why we are actually emphasize on the celebration is to create some awareness among our peoples regarding what is actually kidney disease. Some of you might not know patient with kidney disease is actually in an increasing trend in Malaysia. There are about 15% of our Malaysian population are suffering from different degree of kidney disease or kidney failure. As much as 42,000 of people are currently undergoing hemodialysis or CAPD as a renal replacement therapy. So today's session is mainly to actually advise and give some suggestion to patients with CKD disease, CKD, which means chronic kidney disease, some form of dietary advice so that they can be more healthier, they can be healthier and have some good food so that their general well-being is maintained. A lot of people is actually asking, a lot of food cannot be taken, cannot be consumed by patients with kidney disease. Some of them are very, very frustrated because almost every food, there are some limitation. But don't worry, today we are fortunate enough to have our dietitians, Ms. Wani, and her team to teach us how to eat as a patient with kidney disease. Before we go through the main menu of today, which is a cooking sessions and demonstrations, you shall bear with me with some introduction and slide to tell you what happens, what should be changed to the diet of a patient with kidney disease. Okay, our World Kidney Day was celebrated on this 11th of March 2021, basically the second Thursday of every March. Today I'm going to talk about some aspect of food and nutrition for kidney patients. This is some of the most people will ask about these questions every time they came into my kidney. I have kidney problems. What should I eat? What should I reduce? What should I control? So today, this year, we are having our theme of living well with kidney disease. Basically, we want to increase education and awareness about symptom management and people empowerment with ultimate goals of encouraging meaningful participation in everyday life. In short, we are actually telling everybody, patients with kidney disease can enjoy their life as normal people, as long as they can know how to control and how to consume their diet. Basically, apart from dietary, patients with kidney disease can enjoy their daily living as normal people. They can eat, they can work, they can exercise, they can have some family life. But how to enjoy eating as a patient with kidney disease? Of course, they should eat according to a guideline. Let us just go through that. So before we go through how to eat, we have to understand function of the kidney. Basically, I tell my patient there are 4 functions, the major function that should know. Of course, our kidney has a lot more functions, but these 4 main functions is the ones that actually the most important. First of all, it filter and remove unwanted product from blood. It acts as a filter. I always tell patients it acts as a filters to remove those who the wastage product and unwanted product and throw it into our urine. People with kidney disease have problem with these filtrations, and they tend to collect or retain this unwanted product in their body. Second, they produce hormone to stimulate the production of a red blood cell. 3, it regulates minerals and salts. For example, calcium, phosphate, and potassium in your body. And of course, it regulates water in the body. And those who actually have kidney disease, some of them have some fluid retention with swelling of the leg because of the waters cannot be excreted in the urine. So there are many ways to maintain a general well-being of patient with kidney disease. But basically, when we talk about diet need to be modified according to this few category. First of all, the protein, salt, potassium, phosphate, and waters. Some of the terms might sound very foreign or alien to all of you, but let us get through one by one. Protein is basically somebody asked why protein will increase will have to be limited, because you have to understand that high protein diet increase burden of your kidney. When you have kidney which already malfunction, you want to reduce the kidney burdens so that it can function longer without having any problems. But of course, we can't actually tell everybody with kidney disease same kind of protein intake. So basically depends on which stage are your CKD disease. So those who have initiated dialysis, not only hemodialysis, protein should be limited, for those who haven't started any hemodialysis or any renal replacement therapy, protein should be limited to 0.8 gram to 1 gram per kilo per day. This sounds very technical. A lot of people are asking, what is 0.8 gram to 1 gram per kilo per day? How much is it? But I think that's our friendly dietitian, Ms. Mani, will tell you how to calculate the protein intake in the next session. But after initiation hemodialysis, protein should be increased because each dialysis session will drain you out from the protein. So protein should be increased to 1 to 1.2 gram per kilo per day. This is a generous advice to all our patients with kidney disease. But these few years, there's a lot of study which actually come out, which actually showing that very low protein diet, for example, 0.6 gram per kilo per day, and very low protein diet, 0.3 to 0.4 gram per kilo per day, could actually give some benefit to person with kidney disease before they initiated dialysis. Some studies show that it actually reduce or slow down the progress of kidney deteriorations. Of course, when you have taken a very low protein, very low or low protein diet or very low protein diet, you will be depleted from proteins. So somebody say you will lose the muscle. You are absolutely right. So a person who couldn't be only consuming low protein diet without any dietary advice or supplements. So people who actually just blindly follow low protein diet without any proper dietary advice or supplement carry the risk of malnutrition. Those who actually choose to have very low protein diet, need supplement with amino acid, which is a different form of protein, which do not carries or having burdens in your kidney disease. But anyhow, for those who very low protein diet, I emphasize again, we should get a proper dietary advice. Then next thing will be salt. So we only allow 1 teaspoon per day. How much is 1 teaspoon? Our Malaysian food, most of it are very delicious. A simple, after a lunch of 1 plate of kway teow goreng, will easily give you more than 1 teaspoon of salt already. So reducing salt help in reduce your blood pressure and reduce your burden to the kidney, and as a consequences, your kidneys health was maintained. Kidneys burden reduced, progressions of deterioration of kidney function was reduced as well. What is the food with high salt diet? Here are the examples. Of course, there are still a lot more to show, but this is some example. Potassium. Patient with kidney disease should familiar with this salt, which is called potassium. It was found mainly in vegetables and fruits. It's an important salt in your body. And what happens in kidney disease is when you have impaired kidney function, you are unable to excrete enough potassium, and this potassium will retain in your body, will become increased in your body. High levels of potassium can cause irregular heartbeat and cause heart stop beating, which is a serious side effect. So what food are high in potassium? You can see dates, fruits, vegetables are high in potassium. And the next things that should pay attention is phosphate. Phosphate is a mineral which found mostly in the bones. It was excreted in your kidney. When your kidney are having problem, phosphate tend to retain in your body. Phosphate become high in body. Okay, you have to understand that phosphate is a mineral that actually found mostly in your bone. How is your bone? Is it hard, soft? It's hard. So this, when you have a lot of phosphate in your blood stream, in your blood, this phosphate will deposit in your vessels. What will happen to vessels? You become as hard as a bone. So where is the vessels? Vessels is in the heart, is the brain, in every part in your body. So when your vessels in the heart becomes as hard as a bone, you block, you had heart attack, you have stroke. At the same time, it stimulate the high phosphate also stimulate a hormone called IPTAH, which actually excreted in your neck area. It will make your bone become very brittle and easily broken, and your vessel become hardened. So what food contain high phosphate? Nuts, egg yolks, dairy product, cheese, milk. Okay, apart from the four main things that actually I discussed earlier, patients with kidney disease also should control their fluid intake, because as I mentioned, they have problem to regulate their water in their body, so they couldn't actually excrete enough waters to make them to be stable. Everybody should reduce sugar intake, but this advice is especially for those diabetic patients, and reduce high cholesterol foods. People will ask me, we cannot take protein, I cannot take potassium diet, food with potassium, I cannot take food with phosphate, I cannot take much fluid, I cannot take sugars, and I cannot take any high cholesterol food. And you still ask me to enjoy my eating. How can I enjoy? I think everybody come out from my room, you have this kind of expressions. They don't know what to eat, and that's the rules of a dietitian. Today we are going to teach you how to eat, and also later on there will be a very interesting demo on how to cook for CKD patient with kidney disease. Before we end, I have to advise that every kidney disease patient had different kinds of blood parameters. Some of them have normal phosphate, some of them have high potassium. So I believe all of the patient with kidney disease should be advised by a nephrologist with a dietitian so that we can design a more suitable diet for you. Thank you.
Hello everyone, welcome to Columbia Asia Hospital Tebrau. I am Wani, the dietitian. Today I would like to talk and share with all of you on how to take care of your kidney in conjunction of World Kidney Day this March. Okay, thank you Dr. Tiff for your introduction just now. So we share about diet for the kidney. Okay, a bit of introduction. Healthy kidney, of course, is very important as it has a various important function like removing waste product and maintain the fluid balance in the body. When this kidney do not function properly, of course, the waste will build up and damage our body. And because of that, we need a special diet to reduce all the waste, to delay the loss of kidney function and maintain adequate nutrition. And it is advisable for patients with chronic kidney disease to exercise, reduce excess weight, reduce consumption of alcohol, and avoid smoking as well. So there are 5 diet rules for healthy kidney, which I will go one by one. First is protein. Of course, protein is very important for us for growth and maintenance, but you need to know that different person have a different requirement for the protein intake. For a normal healthy person, of course, the recommended protein intake is 0.8 gram per kilogram body weight. And a very low protein diet starts from 0.3 to 0.4 gram per kilogram body weight, whereas a low protein diet starts from 0.6 to 0.8 gram per kilogram body weight. However, the protein recommendation is determined by various factors like age, activity level, and stage of kidney disease. Okay, I show you some example. Let's say this patient weight is 50 kilogram. So, and then this patient is a normal healthy person. So 50 kilogram with times with the 0.8 gram per kilogram body weight. So we got 40 gram per day. So how much is 40 gram? You can refer to this food chart. Okay, this food chart shows a protein-rich food and a protein content in carbohydrate food. For the protein-rich food, all this picture show 1 serving, which equivalent to 7 gram of protein. Whereas for the carbohydrate food, all this 1 serving contribute to 2 gram of protein. Let's say for breakfast, you take a glass of milk and also 1 nose of egg, so you get total of 14 gram of protein during that breakfast. So you need to add up with all the food that you eat for the total protein that's contribute to the 40 gram of protein in a day. Second is sodium. When we talk about sodium, we will think about salt. Yes, of course, but the recommended sodium intake per day is less than 2,400 milligram per day. So how much is 2,400? Is equivalent to 1 teaspoon of salt. Okay, we need to know that too much sodium intake can be harmful for the kidney. Remove all the excess sodium. Okay, it can cause water retention in the body, which can cause edema, heart failure, SOB, shortness of breath, and increase in our blood pressure. Okay, these are the list of the food which contain high sodium content. For example, all the processed food, canned food, okay, preserved food. Okay, we can see the ketchup, the sauces. Okay, and then you see the chicken stock as well. Okay, the telur masin, the seasoning, ajinomoto as well. Okay, actually there are some tips for us to manage the sodium intake in a day. First, of course, eat less salt and food high in salts like seasonings, condiments, processed food, frozen food, canned food. So basically, you need to go for fresh items. Okay, instead of choosing fruits in a can, it's better you choose fruits that are fresh. Okay, second, choose low salt or no salt added product. When you go for your grocery, you can check the nutrition fact. Try to choose a product with a low salt content, which is less than 140 milligram of sodium per serving. You can refer to the nutrition fact as attached. Okay, next you can enhance flavor by using fresh or dried herbs and spices instead of using the cube chicken stock, Ajinomoto, all the stock that already prepared. And last, of course, eat more home cooked food. Make sure to not sip the gravy or any dishes with your gravy as it contains all the sodium inside it. Okay, the third is potassium. The recommended potassium intake is less than 2000 milligram per day. We need to know potassium that is too much in our body can cause irregular heartbeat, numbness, and chest pain, as well as mentioned by the Dr. T just now. Okay, these are the list of the food with high potassium content. As you can see over there, mostly comprises of the beans, legumes, bread. Okay, you can see here durian. Okay, the most typical fruits lover by the Malay. They have banana, all the green leafy vegetables. Okay. And here are the list which shows potassium content, low, medium, and moderate. Okay, it's not means that you cannot take all this kind of food. You can take it, but you need to balance. Let's say you take rice, maybe you want to take spinach for lunch. Try to mash with the fruits with low potassium content so that you don't have like potassium overload or too much potassium you consume in a day. Okay, actually there are some tips for us to reduce the potassium in food. First, you can wash and soak the vegetable after cutting so that the potassium will dissolve in the water for 15 minutes. Okay, second, limit the intake of gravy from any dishes that the potassium already dissolved in the gravy. You can eat canned fruits, but without the syrup. And you can peel the skin of fruits before eating. Okay, for one is a phosphate. The recommended intake is less than 1000 milligram per day. As you all know that normal working kidney can remove the extra phosphorus in our blood. But when we have a kidney problem, our kidney cannot properly remove the phosphorus from our body. And too much phosphorus can damage the body. Extra phosphorus, it can change the body by pulling the calcium out of the bone, making them weak and fragile. Okay, so these are the list of the high phosphate food. For example, you can see it comes from the chocolate, from the dairy products, from the cola, from the beans, legumes. You can see from the bread as well. Okay, these are the list from the low, medium, and high content of phosphate in the food. Like I mentioned to you, you need to mix and mash. You cannot take all high phosphate food in a day. You try to mash with the low phosphate food as well. Okay, there are some tips also to reduce phosphate in food. Make sure to bring your phosphate binder when you're eating outside, as it helps to prevent the absorption of phosphate in our body. Second, avoid eating cartilage and soft bones of fish, shellfish, and meats. Okay, you need to limit the chocolate, cola drink, and dairy products that contains all the phosphate. And of course, we encourage patients to exercise, increase our daily activity. The more we do this, the more phosphorus we get rich by our body. Last, of course, fluid. Okay, fluid here refers to all kinds of drinks, beverages, and soup as well. Okay, you need to ask your doctor or even your dietitian how much you need to limit fluids and how much is okay for you and how to measure the fluid intake so both of us can guide you on it. And as we know, fluid overload can cause edema, shortness of breath, discomfort, high blood pressure, and heart problem as well. Of course, there are some tips also to reduce thirst. If your fluid intake is very limited, let's say your fluid intake in a day is a 500 ml, how are you going to utilize the 500 ml? You can having a sour hard candy or chewing gum in order to moisten your mouth. You can rinse your mouth with water or mouthwash as well. You can sip on a fresh lemon or something soury because all the soury things can stimulate our saliva production. You can moisten your lips with lips moisturizer or water whenever you feel dry. Next, of course, avoid salty, sweet, and spicy food as all these food will induce the intake of fluid in our body. Next, we encourage patients to measure the fluid intake per day and make a record of it by using a household measurement. Normally, the dietitian will guide you on the household measurement how much is 1 teaspoon cost in ml. Okay. Next, choose non-watery fruits like guava. Don't choose the watery fruits like watermelon or pineapple, which is less in fiber but too much water. Okay, and last, avoid exposure to hot weather. It's not means that you cannot go out for jogging or anything. You need to limit your time spending outside. You can go for exercise, maybe in the gym. Okay, this is example of the household measurement. Let's say for our tablespoon, it contribute to 10 ml, for teaspoon, 5 ml. You can see from our rice scoop is 60 ml, our glass 300 ml, mug 300 ml. You can see from the picture. Okay, in conclusion, of course, you need to eat well, balanced diet, and exercise regularly in order to maintain a healthy kidney. Talk with the nephrologist or the dietitian if you need any supplement or if you need any individualized consultation. So we will guide you on how much you can take in a day and how are you going to utilize the amount of fluid, the protein in a day. Okay. Okay, last but not least, I would like to invite all the people out there who have any concern or doubt or any you want to know much more better about the renal diet to come and meet the nephrologist and the dietitian. So I'm giving a 30 ringgit rebate for the dietitian consultation and also free cutlery set and one free subirina. Free subirina is complete nutrition with 6 grams of protein. It can be taken as a meal replacement. You can come over Columbia Asia Hospital Tebrau and redeem for their voucher from the dietitian. Okay. Okay, that's all for today. Thank you for joining us. Thank you for listening to my talk. And I hope you get some input on how to take care of your kidney so that you will have a better quality of life. So you know, actually it doesn't mean that you cannot take all food. You can take it, but all in moderation, or you need to measure. Okay, so I will share you on the cooking demo after this. So hopefully you enjoy, and if you have anything, please come and meet the dietitian and nephrologist. Thank you.
Okey, bahan-bahan dia adalah bahan utamanya pucuk manis, tomato, daun ketumbar, bawang merah, kelapa yang telah disangai dengan serbuk kunyit, bunga kantan dan juga serai, cili merah, sayur tauge, sedikit lime juice, garam dan juga gula perang. Seterusnya saya akan campurkan semua bahan-bahan tadi untuk membuat kerabu. Sedikit tomato, daun ketumbar, bawang merah, cili merah, bunga kantan dan juga serai, tauge, kelapa yang telah disangai. Kemudian saya akan ambil sedikit garam, gula perang dan juga lemon juice. Dan saya akan gaul dengan sebati. Okey, bahan seterusnya kita ada ayam yang dah dibuang kulit, oyster sauce dan juga minyak wijan, cili merah, daun ketumbar, tepung jagung, mushroom dan juga wolfberry seed. Okay, seterusnya saya akan campurkan bahan perapan ayam, oyster sauce dan minyak wijan dan juga tepung jagung. Kemudian kacau sebati supaya perasa tu masuk ke dalam. Okey, seterusnya saya akan campurkan ke semua bahan yang tadi. Mushroom, berry seed, cili merah, daun ketumbar. Kemudian saya akan campurkan sedikit air. Dan kita akan kukus dia. Okay, saya akan masukkan ayam ke dalam kombi oven untuk mengukusnya. Okay, untuk suhu dia 100 darjah Celsius dan juga 15 minit untuk mengukus dia.
Okay, actually for all kidney patients, there is some restriction in terms of their diet, but however, they can still eat healthily but follow the recommendation and guideline as preferred by the nephrologist and the dietitian as well. So I invite Dr. T, our nephrologist, to have taste our food.
To be honest, the food look very nice. If you can see the food, oh, I just can't help to try this thing. This is
Chicken steam was very.
it looks so delicious. Let me try. It was so tender. The taste is nice. Let me try this. Together with the rice.
This is kerabu pucuk manis with tauge. Still, you can still enjoy the food, but you need to follow the recommendation as what we get you.
To be honest, it was really delicious. Okay, I hope you can enjoy this session. If you had any doubt on how to prepare food which is suitable for you as a kidney patient, you can always come to us. I think Wani will be ready to assist you and help you to enjoy your life and especially your food. Thank you.